Without further ado, I would like to introduce Connor Griffin. Connor Griffin is the Director of Health Care Advocacy with the ARC of New Jersey. The Health Care Advocacy Program promotes quality health care for individuals with intellectual and developmental disabilities throughout New Jersey. Connor received his master's degree in public health with a concentration in health systems and policy from Rutgers University. He received a Bachelor of Arts in public policy with a minor in public health from the University of Delaware. And we are so excited to have you here today, Connor. Thank you so much for being here to talk about your amazing program. With that, I'm going to turn it over. And again, thank you for being here.
Thank you for that wonderful introduction, Erin. So without further ado, I'll get right into my presentation here. So a little bit about myself, which Erin just went over, but my name is Connor Griffin. I am the Director of Healthcare Advocacy here at the ARC of New Jersey. I received my master's in public health from Rutgers University, New Brunswick, very local, their School of Public Health, and I concentrated in health systems and policy. And I also received my bachelor's in public policy from the University of Delaware with a minor in public health. So to just get into a little about the program and what we offer here at the ARC of New Jersey, the advocacy program is something that some of you might have known formerly. It used to be the Mainstreaming Medical Care Program, often abbreviated MMC, but we have now restylized the program, and it is the Healthcare Advocacy Program. But largely, the goals and the mission of what we're trying to accomplish with this program does remain the same, and we're looking to promote quality healthcare for people with intellectual and developmental disabilities throughout the state of New Jersey. My program is especially funded through the Division of Developmental Disabilities, or DDD. So to provide a little bit of background on the types of information and topics that my program both advocates on and deals with a lot on a day-to-day basis, we provide information advocacy across a variety of healthcare topics and also related issues for people with IDD. And this can include, but is definitely not limited to, New Jersey Family Care, which is the state's Medicaid program. And this also encompasses numerous aged, blind, and disabled, or ABD programs, which fall under that umbrella of NJ Family Care. It can be a bit confusing, but when I'm talking about Medicaid or NJ Family Care, they tend to be the same thing. NJ Family Care is just the name that New Jersey opted for when designated their Medicaid program. And for the most part, concerning individuals with IDD, as well as their families and caregivers, we're going to be talking about the ABD Medicaid, because that's usually what most individuals are eligible for and receive their services through. Many of you might have heard of or already be aware of the Medicaid unwinding or the renewal process. This has been going on since last April, so it's been going on basically about 12 months now. And this unique unwinding process is undergoing nationwide renewal because during the COVID-19 pandemic from March 2020 through March 2023, it was continuous Medicaid enrollment. And during that time frame, all the state Medicaid programs, including New Jersey, they weren't doing renewability checks for who was eligible. So people who might no longer have been eligible for the Medicaid program, they got to stay on the program through those 3 years. But since last April now, the state of New Jersey, as well as the rest of the country, has been doing a massive undertaking in doing renewability checks for all NJ Family Care members, and that is still ongoing. We also deal with the dual eligibles. These are individuals who are receiving Medicaid as well as Medicare. Many people don't think you can get Medicare until you're 65. This is not true. There are exceptions for those under 65, namely those who do have a disability. For individuals who are receiving SSDI or Social Security disability income, either based on their own work record or if they receive it through a parent who might have retired and started collecting Social Security, became disabled themselves, or passed away. A child with a disability, they can become eligible to receive that SSDI. And after 24 months, they automatically start receiving Medicare, and they can receive Medicare in addition to Medicaid. And that's someone who's known as a dual eligible. My program also deals a lot with supplemental security income, otherwise known as SSI. This is something that many individuals, when they turn 18, we encourage them to apply for. And you may become eligible. And what SSI is, it's a monthly cash benefit, but it's also very helpful because if you're found eligible for SSI, you're automatically enrolled with NJ Family Care, and you don't need to do a separate application. I was just talking a little bit about Social Security disability income, so I'll skip over that. We also cover disabled adult child, or DAC, and non-DAC. This occurs when what I just talked about a little bit before, but when that parent of an adult child with a disability, they retire, or they start collecting Social Security through their own disability, or if the parent passes away, this is referred to as a survivor's benefit. Then you're talking about a disabled adult child, and this can result in sometimes different eligibility standards and how someone is able to receive Medicaid. But those topics aside, we also cover more traditional healthcare topics, namely among them for individuals with IDD, oral health and dental care is a big one we see, that there tend to be a lot of barriers to accessing care, whether it's through Medicaid and providers not participating, or just for other reasons. But oral health and dental care, that's a big thing we advocate on. We're always trying to make sure that individuals with IDD can hopefully access it, and we're advocating for better services in the future. Dual diagnosis is a term that refers to an individual who has IDD, but also mental health or behavioral health challenges. This can be incredibly difficult and challenging, on top of an individual already having their own disability, to have mental health or behavioral issues as well. We recognize it can be very difficult. That's why part of why my program is here. We offer services and advocacy to do our best to help on that front. And lastly, we also advocate on just other medical care services. Lots of times parents or caregivers, they need help with being referred to a provider. And we do have contacts and lists who we are happy to help with helping to steer you if you're in a certain county and you need a specialist or just a general practitioner sometimes. We are able to assist with getting you on the right path to accessing a provider that you might need. So I also just want to point out that we do have a new website. It looks a little different. If you're someone that was on our website last year, for 2024, new year, new website, it looks a little bit different. But we've reorganized a lot of the same information. So, there's no shortage of resources and fact sheets, and, we still have our webinar library. So if you go on our website and you go over to my healthcare advocacy program, it's been reorganized to some extent, but we still have a lot of information, and we tend to break it down based on what you're looking for. So, we have our webinar library, we have Medicaid specific resources, those, dual diagnosis, dual eligible resources, Social Security resources, all that. I highly encourage you, please go over to the website, make sure you're visiting those resource pages. If you have any questions about these topics, we try to post as much up-to-date information as we can. And I'm also constantly trying to update information and fact sheets with new numbers that tend to come out every year. But I'm also trying to post, the latest healthcare news and advocacy information, on the website, but also through our email list, which I'll also talk a bit later. So in terms of what my program specifically offers, we offer both individual and systems advocacy. information, resource, and referral. We do problem intake on our website as well. We have its own page that's dedicated to, we have forms that are uniquely suited that you can fill out, return to me. Very helpful for me to get all the information that I need, and then I can do the best on my end to either help directly with your problem, or if I need to refer you to someone else, a different organization or a contact, filling out those problem forms are paramount in me being able to assist you in the best way that I can. We also offer a number of presentations, webinars, and educational videos. We do in-person presentations, but also a lot of what we do now since the pandemic is we offer a lot of virtual webinars and webinar series. That tends to be more convenient and more accessible to a broader audience. We also have a brand new Facebook Live bi-weekly series. I'll be talking about this a little more later. It just debuted 2 weeks ago. You can also find recordings on our website, as well as the ARC of New Jersey Family Institute Facebook page. They'll be going up on those as I release them on a bi-weekly schedule. The Healthy Times virtual newsletter is something else that's been brought back. It just went out a few weeks ago, our March edition. That's something that goes out several times a year. And if you're signed up for our email listserv, which if you're getting the emails, you'll also be getting the newsletter. If you're not already signed up for that, I encourage you to go over to the ARC of New Jersey, our main website page. If you scroll down to the bottom, it has information about signing up for that email list. For my program, you need to check off healthcare issues. And through there, it'll take you prompts to make sure that you're getting signed up for our email list, and then you'll be getting all the emails and newsletters that I'm sending out on a regular basis. We also do an annual webinar series that's unique to my program. It's usually offered about this time of year in the springtime, the winter, springtime. And this is featuring medical and healthcare professionals, guest speakers from different backgrounds and expertise. And each year there tends to be a different theme or a new type of topic in specific that we want to cover in depth if we think it's very important for individuals with IDD and their families and loved ones. So that's something else I'll also be talking a little bit more about later in the presentation. And of course, we offer a number of fact sheets, flyers, and other resource materials. We're constantly always updating our old ones to make sure they reflect the latest information and numbers. But I'm also, I try to have my ear to the ground and be listening to families and individuals, trying to hear what topics are most important or what they're struggling with the most on a day-to-day basis. And that helps me be informed of what type of information I need to be putting out there. So that's very valuable in what I do on a day-to-day basis. So individual advocacy, obviously my program with Healthcare Advocacy, we're chiefly advocating for individuals with IDD, but also family members, caregivers, and loved ones, as well as healthcare professionals and medical professionals. We want to make sure everyone's as informed as they possibly can be and have the information and resources to feel empowered about the decisions that they can make. Just in case anyone is, a little confused about what does individual advocacy mean, I provided some examples here of what individual advocacy issues look like as they're suited to my program and the types of things that, individuals and families tend to ask me. So say an adult child with IDD is losing SSI and Medicaid due to the receipt of SSDI from a parent's work record. And as I had mentioned a bit earlier, this can occur when a parent retires and they start collecting those Social Security benefits, or if the parent becomes disabled, or in the unfortunate event that a parent passes away and their child starts receiving those survivor's benefits. This might be an instance where, the child with disability, they are going to start receiving that SSDI. And unfortunately, what can occur is this jeopardizes the SSI and the Medicaid, and you need to get back on those programs through. Another example of individual advocacy might be a parent who's struggling to find an MCO or a managed care organization, a healthcare provider for a family member. For those who are enrolled in Medicaid in New Jersey, There are 5 to managed care organizations that they have their own unique plans and benefits, as well as healthcare provider networks. So a lot of time what we'll see is maybe, a child gets enrolled in a Medicaid program. If they don't choose an MCO, they get automatically enrolled into one. And then maybe that network isn't best suited for where they are or what their personal needs are. And they need to, sometimes they need to switch to a different network, to a different MCO to access the providers or the services they need. So that's something that I can help with, and we are definitely able to help on. Another matter might be a child is turning 21 and they need DDD services, but they're receiving a monthly benefit from a deceased parent that makes them ineligible for Medicaid. And that's that non-DAC I mentioned before. This is something that can occur. So someone needs Medicaid to get on DDD services upon turning 21, but sometimes if a parent passes away before a child is able to get SSI, then their income is too high, and sometimes it can be tricky with getting them the Medicaid, which they're also going to need for DDD. But again, that's something I can help on. I have expertise, and if this is something that sounds like you're dealing with or you might be dealing with in the future, please reach out to me. These are the types of things that I can help on, and I'm here as an advocate for. So how does systems advocacy differ from individual advocacy? So systems advocacy, as the name somewhat applies, it's going to focus on more broader systems-wide issues. So how can the healthcare system and policies better accommodate and be tailored to meet the needs of individuals with IDD, as well as their families, loved ones, and caregivers? So here at the ARC of New Jersey, both my program and our broader organization, we advocate on a number of local, state, and federal issues as it relates to healthcare and individuals with IDD. So to provide an example of what this might look like in terms of systems advocacy, say one of the biggest issues that we might see with Medicaid is low provider participation, because reimbursement tends to be lower for Medicaid than it is for Medicare or private insurers. So one thing that we might do at the ARC of New Jersey here is advocate for higher Medicaid reimbursement rates so that more providers are going to participate with these Medicaid managed care organizations, these MCOs, and then they will be available to more individuals, especially those that have IDD. So that's an example of what systems advocacy might look like in the context of both my program and the ARC of New Jersey. Information, resource, and referral is another big thing that we do here in my program on a day-to-day basis. So as I've kind of touched upon already, we're always disseminating fact sheets, flyers, informational emails through our listserv. And these cover a bunch of different topics, most of which I've already talked about to this point. But whether it's NJ Family Care, Medicaid, the unwinding or renewal process, SSI and SSDI, or dual eligibility and dual diagnosis. And obviously that is not an exhaustive list. There are other topics that we cover, and I am able to advocate upon. Those just tend to be some of the biggest ones. If you go over to our website, we have a dedicated fact sheets and flyers page, and this includes links to all the most up-to-date fact sheets and flyers. They tend to be as updated as possible, as well as the new ones I've produced. Please go over and check it out. If you have an issue about a certain thing, instead of reaching out to me first, you might be able to find that there's a fact sheet or flyer that is able to answer your question. That's why we try to design them. We try to make sure that you have the information without necessarily needing to go to me. But of course, there are some topics that might be a bit ambiguous, and I'm always here to help if you do need further information or advocacy on something. We also do have dedicated resource pages specifically just for Medicaid and Social Security, and these have an extensive array of resources on them, whether it's other organizations that can help you on matters. When it comes to Social Security, sometimes you need to appeal a decision, say an SSI denial, you think it's wrongful and you want to appeal, we have referrals to attorneys and legal organizations that can assist if you do want to appeal that denial. In terms of Medicaid, we have resources and referrals, whether it's, doing a Medicaid appeal, or you need to access one of their helplines or help centers, or anything along those lines, as well as those pages are also going to have links to our fact sheets, our flyers, as well as past webinars and presentations that we've done on those topics, because we do them quite often, and always when they're recorded, when we do them virtually, what we make sure to do is as quick as possible. We get the recordings, we get the slides up on the website. So there might be a presentation that we've done in the past 6 months, in the past year, that already talks about a number of Medicaid and Social Security issues that could pertain to your situation. Please go over to our website, make sure you're looking at those presentations if they pertain to you. But we're also, of course, always doing new presentations as needed, because things change on a month-to-month, year-to-year basis with numbers and regulations. So we're always putting out new information in that regard. So the problem intake that I talked a little about before, we have 2 different forms, and they are available if you want to print them out and fill them out and either fax or scan them to me. Or we do have a brand new online form. You can totally fill it out online on on our program website. You don't have to print it out. You don't have to scan it, nothing like that. You can put in all your information, submit it, and it goes right to me, and I'm able to see what's going on and how I can best assist you. But we do have a Medicaid eligibility problem form, and this is something I will often encourage families to fill out. And this is if someone's having an issue with obtaining Medicaid, or they think they're wrongfully terminated. That form is going to be most useful for me to see what's going on, what do income and resources look like, what might have happened, why the individual is not being found eligible for Medicaid, and then I can intervene and see how we can best go about getting that person back on Medicaid, or getting that initial Medicaid if they haven't had it. So there's a link in the slides to that form if you need to access it. We also have a Medicaid problem form that's more designed so if there are specific issues going on with your Medicaid HMO, that stands for Health Maintenance Organization. That is the same as the MCO. They can be used interchangeably. If I'm talking about Medicaid HMO, I'm talking about a Medicaid MCO, just as NJ Family Care is the same as NJ Medicaid. They are the same. But make sure you're using that Medicaid problem form. If you're enrolled to Medicaid HMO and you're having difficulty accessing a service, or something that you think should be covered by the HMO, and for whatever reason they're saying it's not, this is something else that I can also help with. So if that sounds like it's something you're going through, fill out that form and get it over to me, and I'll be happy to help. As I've talked about, we do a number of presentations, webinars, and educational videos. Upon request, we're happy to do these in person for organizations, staff trainings. I just did one a few weeks ago. Please, if you're a professional or professional organization and you're looking for a Medicaid or a Social Security presentation, we are happy to do those upon request. Send me an email and we can set something up. But also we'll offer a number of virtual webinars and presentations just throughout the year. We like to offer them on a regular basis. And as I had said before, you can find those in our webinar library. All the recent ones we've done in the past 5 or 6 years or so. We're constantly getting those recording and slides up, but we're also looking to always regularly be putting out new webinars and presentations as the need arises, and we see topics that we're getting a lot of questions from individuals and families, and we see where the need is, and that helps determine how we're going to choose what topics for our presentations. But there also are some presentations that we like to do every year, as some things might not change too much, but if we need to get the updated numbers information out there, we like to offer certain presentations around the same time every year. For example, in November, we tend to do a a dual eligibles webinar that is targeted at changes for the upcoming year. A lot of times it has to do with prescription medications because that's on Medicare that they change every year. What drugs are covered, what type of plans are available for when you're talking about Medicare Part D. So that's an example of one thing that we offer usually each November. And we're making sure the information is going out a few months before the start of the new year, when some of those changes will go into effect. But please go over to our website, make sure you're looking at our webinar library. It's pretty deep. There's a lot there. So I talked a little about this before, but this is one of the brand new things that my program is offering, and it is a Facebook Live series. For anyone, they might have seen them. We used to have over at the Family Institute, one of our other programs did Mondays with Michael. There's some similarities with that, but this is now with my program, Healthcare Advocacy, that it'll be on Thursday afternoons at 2:30 p.m. Eastern Standard Time. And this will be on a bi-weekly basis. So this will be every other week. So, I'll be having one this Thursday at 2:30, but please do not tune in next week at 2:30 because I will not be going live with any new information. But it's catching up with Connor. And the idea is I want to get information out there that's brief, concise, and informative, but it's a bit shorter than these hour-long webinars as I'm doing today. So it's a bit more accessible if you need information on a specific topic. But, I recognize that many individuals and their families, they're busy, they're on tight schedules. If you need some more information about a specific topic and you only have time for, say, a 10 to 15-minute video while you're on a break or, at night before you go to bed, this is what this series is intended to help with. And I'll be releasing them bi-weekly. It'll be new topics every time. Sometimes it'll be multi-part. Like, for example, a few weeks ago, if you find on our website, you navigate to the archive, I have posted the first Catching Up with Connor installment. And on that, it's broad overview, very basic of NJ Family Care Medicaid. And you'll notice that is part 1 because Medicaid's a little dense for me to cover all of it in 10 to 15 minutes. So I'll be doing part 2 of that this Thursday. But I won't just be covering healthcare topics alone. I'll be covering a lot of related topics as well. Some I've already mentioned today, Social Security, things like that, but also some things I haven't talked about. There will be later editions that include information about special needs trust or ABLE accounts, things that are also highly important and very pertinent in the lives of individuals with IDD. And those are also something that I recognize are very important for individuals to keep their services they're receiving, whether that's Medicaid, whether it's SSI, whether it's both, because those programs, some of them tend to have very strict monthly resource limits for Social Security and some Medicaid programs. As many of you probably are well aware, it tends to be that $2,000 a month resource limit. But those will be things I'm covering in the coming weeks and months as I am very excited to be doing this Facebook Live series. As I had mentioned, it'll be through the ARC of New Jersey, our Family Institute Facebook page. So if you go over to that at 2:30 on Thursday, including this Thursday, you'll be able to catch my next video, which will be an overview of NJ Family Care Medicaid Part 2. So make sure you're tuning in to see that. But if you can't make it, please rest assured that as quick as I can, I get the video up on my program page. So if you go over to Healthcare Advocacy, go to our archive, I have a page set up that's going to have all the Catching Up with Connor series as I produce them. So please check that out. I'm very excited about this series and being able to offer more resources for individuals and families. So I've also brought back the Healthy Times newsletter. I just released a few weeks ago the March edition. So this is something that I try to distribute several times throughout the year. It might not be on exactly a monthly basis, but as new information comes out, Basically, on a needed basis, I like to produce new editions of this newsletter and make sure I'm getting it out to families and individuals. But Healthy Times, it's going to highlight both new and existing resources, upcoming events, healthcare news, legislation, policies, any information that I think can be of some use to individuals with IDD as well as their families. So this includes information that I might post. We have sections of my program's website, the what's new or the latest announcements, where I try to post up-to-date information. But if you're unable to go through there or you miss something in there, I tend to include highly important stuff when this Healthy Times newsletter goes out, as well as you might see some information that if you're subscribed to our listserv, some of that might go out in prior emails. The Healthy Times newsletter tends to be an aggregate of the most important information, but sometimes there is, a lot of new information that might have come out since the last email I distributed. But so if you go to the main, the ARC of New Jersey webpage, our front page, and you got to scroll down to the bottom. From there, you can see how to sign up for the listserv. You got to check off healthcare issues, and that's how you'll get signed up for my program. But of course, you are welcome to sign up for check off as many boxes as you want if you would like to get all the information from all the wonderful programs we have here at the ARC of New Jersey. So this already feels like something I've done in depth a little bit, but fact sheets, flyers, and materials. I'm going to go quickly through this. We offer a wide variety, new as well as updated fact sheets. Some of the new ones I've put out over the last few months include about split application Medicaid, NJ workability, which is very important. That's for individuals who are working part-time or full-time and making more money. Very great program that's offered that an individual like that, they're working, they're making more money. They can also get that Medicaid coverage because in the past, if someone was making too much money, which really isn't that much income, they would be ineligible for a lot of Medicaid programs. So Workability is a great new program that is becoming increasingly accessible for working individuals with IDD. I've also put out a fact sheet about some of the health disparities that exist and are faced and serve as challenges to individuals with IDD. And I also recently produced a frequently asked questions sheet about disabled adult childs. That's very important because parents, especially when they're approaching retirement, they tend to have a lot of questions naturally about how it affects their adult child with IDD. This FAQ sheet hopes to answer a number of those questions. But please go over to the website, see these fact sheets and flyers. They're all available on the website if you go to our fact sheets and flyers section. The annual webinar series I had mentioned earlier, it is underway for 2024. So this year's series is actually Back to Basics, Healthcare 101 for individuals with IDD. This is a 4-part series. My first year of doing this webinar series, I want to take a step back and kind of take a bit more of a broad lens at looking at some of these healthcare issues. So I encourage you to check out our first webinar that came out in this series just a few weeks ago. I'll be talking a bit about that on my next slide. But basically what this series hopes to accomplish is provide an overview of healthcare for individuals with IDD and topics that include accessing preventive care, treatment options, being able to visit and talk with a healthcare provider, oral health and dental care, the dual diagnosis, co-occurring mental health issues for individuals with IDD, and care for aging individuals, helping individuals stay out of those institutions, stay out of nursing homes and being able to live in their own home, live in the community, and retain their dignity and their independence. So this is something that's occurring on 4 Tuesdays. So the first one was on March 19th. Note that our next one is coming up in just 2 short weeks on April 16th. And then the other ones will be in May and June. Please note there was actually recently an update that May 21st date is now incorrect. That webinar will be on May 28th, so it'll be 1 week later. I didn't get a chance to update that. But they're all going to be at the same time. They tend to run from noon to about 1:30. And if you look at these slides after the presentation today, there's a link to register. It's through GoToWebinar. And if you just want to register for one or you want to register for all the rest of them, please check them out. Very informative with very knowledgeable guest speakers. So webinar one, as I had mentioned, that occurred just a few weeks ago on Tuesday, March 19th. It provided an overview of healthcare, provider engagement, and preventive services. Some of the things that I just talked about, evaluation and treatment, being able to talk with providers, how you could just best be prepared for health visits, and what the importance of regular preventive screenings and checkups looks like. This presentation was done by Dr. John Evans. He's a doctor of osteopathic medicine. He did a wonderful presentation. He's the medical director of Overlook Family Medicine Residency and Chatham Family Medicine. He's also an esteemed member of our Healthcare Advisory Board here at the ARC of New Jersey. My program has its own advisory board that's made up of wonderful, very bright medical professionals and healthcare experts who been doing this much longer than I have, so they help to advise me where I need it. But if you go over, we have a tab for the 2024 healthcare series on my program page, and you'll be able to access the recording, the slides from Dr. Nevin's presentation. And then, of course, I'll be populating that section with the copies of the recordings and the slides as the other webinars also occur. I'll be putting them in there. So webinar 2 will be coming up in 2 weeks, and that'll be covering oral health and dental care. And just to give you an idea of what that might be covering, obviously oral health and dental hygiene for individuals with IDD, and some of the things that this topic might cover include some of the difficulties with finding providers. As I mentioned before, it can be a struggle sometimes accessing providers through your Medicaid MCO, and that's especially true for dental care and oral health, even more so than a lot of other areas of healthcare and medical services. The need for specialized treatment and services, for example, sometimes individuals need general anesthesia or other special accommodations, and just not every dental provider is able to offer those services, or they're not willing to. And it's also going to cover some of the higher rates of poor oral hygiene and periodontal disease or gum disease that tend to unfortunately sometimes see higher rates with individuals with IDD. And of course, just overall emphasizing how important it is to maintain good regular dental hygiene, as well as seeing a dental provider to get regular teeth cleanings. The presenter for that webinar is going to be Dr. Evan Spivak. He's professor of pediatric dentistry at the Rutgers School of Dental Medicine and the director of the Special Care Treatment Center. Again, here on the slide, I've included a link. It'll take you to go to webinar registration page, and you can go in there, easily put in information, and know you'll be all signed up for when that webinar is happening in 2 weeks. So I just want to say once again, please visit us at our website. Explore our many resource and program pages. You can find us at, you can either go to the ARC of New Jersey website and then navigate to programs, and you'll be able to find the Healthcare Advocacy Program. But if you want a direct link to that section of the website, the ARC njhealthcareadvocacy.org, you can put that in and it'll take you straight to the Healthcare Advocacy Program page. And as I've already mentioned a few times, please, please, please sign up for our email list, our listserv. Go to the main ARC of New Jersey website page, scroll down, check off healthcare issues. You'll be signed up, and then you'll get all our future, the emails I send out, as well as the Healthy Times newsletters. If you check out our website, you really have a specific question or something that you haven't been able to find a good answer, or it's not clear through the fact sheets or the presentations or any of the other resources that are available on my program page. Of course, I'm accessible here. You can contact me. My email here is included, healthcareadvocacy@arcnj.org. Please feel free, send me an email. I'll be happy to help you in whatever way I can, and whether that's I have a direct answer for your issue, or if I need to refer you to someone else, I will work in the best of my ability to help you with whatever your issue might be. So that concludes my presentation, and now I'm happy to take any questions that might be from the audience.
We do have some questions in the Q&A box. So, and Gina Marie, you just raised your hand. Do you want to unmute and you can ask your question?
Hello.
Hello.
Oh, good mornings. Hi, everybody. Hi, Miss Erin. Hi, Mr. Connor. I'm very grateful for this and thank you much. My question I put in the Q&A, I think he answered it, that you put because a lot of us not Facebook and stuff, so you put it on the website too, so we could find it if we not do all that other stuff. Yes?
Yes.
All right,
Yep.
cool.
I try to post as much as I can to the website. If you can't catch something live, like the Facebook Live series, I'm always looking to post the recordings to the program page so you can access it at a later time or anytime.
That's very helpful. I appreciate. I have a couple of questions too. The one slide you had with the problem form,
Mhm.
I have in the last year my caseworker changed 4 times, and maybe told me that the law says I have a caseworker, I guess I not know the proper name, to help me gateway my insure. So I have a couple of I don't want to take up everybody's time, but I want to know, since you're in the thick of it, if you keep tabs on things like there's like food deserts and there's transportation deserts, despite there being like state programs in place like Access Link and Not Go Everywhere. There's healthcare deserts. And you mentioned it before where like sometimes they're not in the proper grouping cover to help their benefits. It's alarming to me as we age, we get more complex health issues. And I want to know if there's anything that you guys keep track of so we could go to Trenton and help do more proper protective factors for our care as we live and age up, because our numbers are alarming on the charts and it not seem to be slowing down in our state. Does that make sense? I don't want to take up time, so I'm going to shut up. But thank you much. I'm very grateful for this. You changed so many lives and you've no idea how appreciates it is. Thank you.
Thank you, Gina Marie. So those would be issues, those healthcare, those deserts, areas where you can't access services. That's absolutely the types of things that the ARC of New Jersey, we're looking to advocate on to the best that we can. We have delegates that on a regular basis, they are traveling to Trenton to advocate on certain issues. And it's definitely something that, as I had said earlier, we keep our ear to the ground, and it's always something that we're trying to be aware of and advocate on. So I just want to assure you that these are the types of issues that we take note of and we look to advocate on as best as we can.
And Mr. Connor, sometimes I think they overlook because they like where I live, they'll be like, oh, well, there's a hospital right there. But because of my level of need to keep me healthy, protect I don't know how to say this polite, so I'm just gonna come out and say it. A very small, less than a handful doctors tell me that I should go to Morristown or Overlook to get the care level I need to safeguard my life. So I not know if they see it as like a health care issue when that's the case for people with complex needs, which that in itself is alarming, because I not feel I be a complex need just because I'm labeled spectrum. But I'm getting off topic. Thank you. Oh, and we're recording. Oh, for the love of lasagna.
So that's something that we definitely, look to. My program especially, I try to work as close with, NJ Family Care, the Medicaid office, and the MCOs and providers. I'm always trying to make connections and be in contact with them as close as I can so that we can offer better coordination of care and services that are more accessible. So they shouldn't be limited to who they can access based on where they live. But unfortunately, we do see that to be the reality, and that's something that results in these health inequities and disparities, especially for more vulnerable populations that can include individuals with IDD. But I'm always looking to see what I can do, and if I can't do something, I'm always looking to get in contact or find someone that can make the change for the better, and hopefully improve things in the future.
All right. Thanks, Gina Marie. We have in the Q&A, can Medicaid be secondary insurance? Our private has very high deductible. Part 2, I have heard a lot of doctors do not accept if you mention Medicaid and been advised not to mention Medicaid insurance.
So, yep. So the first part of that, Medicaid does typically act, unless it's the only insurance, Medicaid does typically act as secondary insurance, or sometimes you might hear it called the payer of last resort. So if someone has private insurance or they have Medicare, those tend to be the primary insurance, unless there's a certain, sometimes there's services that those don't cover that Medicaid can pick up. Like, for example, one of the big ones that Medicare doesn't cover is vision care, and that's something that Medicaid provides services for. So that might be something that they pick up. But also, if you have a primary insurer that you get charged copays or premiums deductibles, usually what's supposed to happen is Medicaid, where applicable, they do help to cover those some of those premiums and copays and stuff, or at least result in heavily subsidized payments. So that's where they're supposed to help. As for part 2 of that question, Erin, could you just read it again?
Sure. I've heard that a lot of doctors do not accept if you mention Medicaid, and I have been advised not to mention Medicaid insurance.
Yep. So as I touched on in my presentation, but unfortunately, one of the realities of Medicaid is a lot of providers won't treat Medicaid patients. Usually this has to do with low reimbursement rates. They don't get paid as much as they would by a patient with Medicare or with private insurance. It all depends on your unique circumstances. Sometimes individuals or families, they don't have a choice if Medicaid is the only form of insurance. What I will say is, something that can sometimes help with that is make sure you're mentioning what your MCO is. Don't just tell a provider you have Medicaid and they'll automatically turn you away, because some of them will treat, some of them are in network with certain MCOs, but not other MCOs. So I would say something that can help with that is, always make sure you're saying what the actual name of your MCO is, whether, you have Aetna, or you have United Blue Cross Blue Shield, or, Fidelis Care, make sure you're mentioning what the actual MCO is. Sometimes that can help, but it also depends on the service someone is receiving, because sometimes there's services that Medicare or a private insurer, they're not going to pick up, and you do need to utilize the Medicaid unless you want to pay full out-of-pocket costs, which no one wants that, of course, but it's going to depend on your individual circumstances. But I understand the struggle with certain providers and being able to see them, but there's also instances where providers should be treating a Medicaid patient, they might not be. Like if a Medicaid HMO has them listed and the provider is not treating a Medicaid patient, that's something to report to the MCO, because if they're listed in network and that provider is sticking their nose up at that and not treating someone, that's something to report to the MCO or NJ Family Care as well sometimes. So something to keep in mind.
And then we have in the chat from Sanket, hi, I want to set up SNT for my son, but it seems a cumbersome process and expensive. How can the ARC help me? And thanks for this presentation.
Sure. So special needs trusts, there is a bit more, it's a bit more set up, and there do tend to be upfront costs, because the thing with special needs trusts is you typically do require an attorney to help you set them up. So there's a fee with using the attorney. What I would recommend is, if you don't already have one, I would open an ABLE account. That's Achieving a Better Life Experience. That was an act passed in 2014. And basically what the ABLE account is, it is a unique tax-exempt bank account that you can deposit up to $18,000 a year into that account and still remain eligible for public benefits programs like Medicaid and Social Security. So if you're someone that, you're struggling to stay under the $2,000 a month limit, I recommend first opening the ABLE account. It's something you can do online. If you want more specific information, definitely shoot me an email and I can send some specific resources. But you can open the ABLE account online. As I understand it, it maybe takes about 45 minutes to put in all your information, open an account, and then you have that to use to put funds in that are tax exempt, and you can remain eligible for those public benefits programs. Now, if you already have that, or you've, say reached that $18,000 limit for deposit, then you need to maybe look at a special needs trust, and I can provide resources, referrals to attorney groups or legal organizations that have specific expertise with special needs planning. That includes special needs trusts. So I'm happy to provide referrals for that. But the special needs trusts, yes, you need an attorney typically. There's fees to opening them up, and yearly fees. But the thing with special needs trust is there's not that annual limit like with the ABLE account. So you can put more money in the special needs trust. So sometimes individuals, if they're working, they're on workability, they're making a lot of money, and they might reach that $18,000 limit, and then they need the special needs trust. So, but feel free to send me an email, and I'm happy to provide resources about opening a special needs trust.
Excellent. They replied, I have an ABLE account, but it needs financial POA and the legal guardianship doesn't work.
Okay. Yep. So feel free to send me an email, and I can definitely assist on special needs trusts.
Excellent. That was amazing. That was so much information to go over, Connor. Thank you so much. And everybody should have Connor's information if you have any specific questions about a circumstance, or if you have more questions about Connor's program, Health Care Advocacy. Please feel free to reach out. And Connor, again, thank you so much for being here and for providing this information. And thank you to all of our attendees who also came. And I hope everybody has a wonderful rest of your Tuesday.
Thank you. My pleasure, Erin. Thank you, everyone, for attending.